Hi, everybody. Welcome to today's career chat. I'm Krista Harmon. I am a workforce development consultant with the Kent Intermediate School District. And I'm so happy to have Kayla Ewen with us today. She's a surgical technologist. Welcome, Kayla.
Thank you.
So our goal for these career chats really is to learn about careers that young people may not know about, or maybe they've heard, but they need more information to make some good choices for themselves. So as we talk about your role as a surgical tech, take us back to when you were about 15 or 16, Kayla. Did you even know what a surgical tech was? Did you want this career when you were that age? Tell us about that early thinking.
No, I had no idea what it was. Starting in high school, I always knew I wanted to be in healthcare. I started out in dental. So no, but I did not know anything about surgical technology.
And what about dental at the time was even an interest? Where was that coming from?
I've just always loved teeth. I don't know. I just had a really good opportunity fall into my lap with my own dentist, where I learned right alongside him. So that was my first path.
So when did you realize, this dental thing is not my thing? Because a lot of young people will have that moment where they're like, that's not what I thought I was getting into.
I enjoyed it. I worked as a dental assistant for a couple of years. I went to school originally to be a dental hygienist, and just somehow ended up changing paths. Still into healthcare. I went into radiology for a little bit, and then I started a family. So I stayed home for quite a while, 10 years or so, before I went back to school and learned about surgical technology.
And I think that's great for young people to hear, Kayla, because, sometimes we think this is linear, that we make one choice and we just head straight for it. And so it's so great to hear that it's a journey and that you've been in healthcare in a variety of things, that it's not one thing you're stuck with. Once you decide it, you can change. You can get more education and change it. Tell us about some of that experience making those changes. What were some of those turning points? Did you talk to people? Did you kind of wrestle that by yourself?
I had one friend that was a surgical technologist that I met probably 10 years ago or so. And I had a few friends that were in nursing. I had considered nursing, actually. And when I went to go back to school at Baker in Muskegon, my original path was nursing. I had spoke with my advisor, and she introduced me to surgical technology. So I decided to go that route.
Were you always good in science and math in high school? Was that an easy thing for you, or was that not so easy?
I was pretty good in those two aspects, yeah.
Yeah, that's good. And is it a make or break for young people that maybe are struggling in maybe some of their math or science classes? Is this something they should not consider, or is there ways to get through the education to be able to do this job?
No, I think there's ways. I don't think it was super math heavy, mostly science, I would say. Some microbiology, but it wasn't a ton of math that I remember. So.
Okay, that's good for them to know. And obviously study groups and some of those other supports make a big difference during that process.
Sure.
So you did dental hygiene for a while, and then you were in radiology. So tell us about, and we have to have career chats on those topics. In fact, I think we might have some in our archive. So young people, if you're interested in that, we have information. But let's focus on the surgical tech.
Sure.
So you were at Baker. They're one of the few programs in the area of West Michigan that has the surgical tech.
Yeah.
Tell us, how was that a 2-year program, 4-year? What was that about?
I believe it's 2. I think that's what I did, though, was I took some classes prior, like when I thought I was going to do nursing for a little bit. I took a few classes here and there, so that when I actually got in, I think I was ahead of the game. I didn't have to take another science class on top of my surgical tech classes, but I think otherwise they combine it to where you can get it done in 2 years, I believe.
Yeah, and I think that's great to know that some of these are stackable. Like you already had training and education in health, and then you specialized in this particular area. You didn't have to start from scratch.
Sure. Yes. I did have to redo a science class because it had been so long, but otherwise, yeah.
Who was your employer at the time, and did they help pay for any of that?
Yes, I was employed by Spectrum Health prior to my role in the OR. I worked as a nurse tech in the emergency department at Butterworth, along with going to school. So at the time did have a tuition reimbursement program. I'm not exactly sure how it works anymore. I know there is some for high demand careers, which surgical technology is. So I think there's still options there for that. And I do know that they actually started an apprenticeship program with GRCC, I believe, where I don't know exactly how it's working. We have three people right now that are doing that. They actually work within our department as surgical SASTs, they call them. So they're like our helpers in the OR with opening trays and stuff like that. But they're being trained right alongside then to do surgical technology. So there's options for that. And I believe it's all paid for. Like, I don't think they're going to have to pay for that afterwards. So
no, I really want to point out that subject for young people and their counselors or parents who are on this call, is that there are some amazing programs going on right now that, yes, you do not have to go into debt at all for any of these health careers. GRCC has amazing scholarships. Spectrum gave them $4 million a few years ago. There's lots of money there. And then these apprenticeships, which I know they're going to be offering a respiratory therapy apprenticeship in the next year or two. But yeah, surgical tech, medical assistants, there's all sorts of apprenticeships where you are learning on the job while you're getting paid and you're not going in college debt. So that's fantastic.
yeah.
So when you first started your training, like, had you always wanted to be in the operating room? Is that how you realized you wanted to do this as a nurse tech? You're like, oh, I like that job that I see in here. How did that come to be?
Yeah, I didn't know a ton about it, but then when I spoke with my advisor at Baker, she was very eye-opening, and I learned a lot about. I'd never had a major surgery before, so I never had thought about it. I mean, I had my wisdom teeth out. I think that was about it. So, yeah, but it's been great. It's definitely eye-opening stuff that you may not know, anything about. So
Yeah, because I have young people tell me they want to be surgeons, but there's so many other jobs in that operating room. Why don't you tell us what then a surgical technologist is?
okay, so surgical technologist works right alongside the surgeon, physician assistant, residents. We are responsible for setting up the sterile field with all the instruments that will be used within surgery. So you are a very important role within the OR. Patient safety starts right there with making sure that everything that you do stays sterile and safe for patient use. So we get everything set up and the patient comes in, and then we prep the patient for the procedure they're having done, and you stand right next to the surgeon. A lot of people will call us the instrument passer, which, I mean, there's no denying that. That's what we do basically. But doctor says scalpel and you hand him the scalpel. So, or whatever. And you learn the procedures as you go, and as you work with the same surgeon for a while, where you'll pretty much know what that surgeon wants before he even knows he wants it, or she. So our job is very important. Yeah.
That sounds like it. You're part of that critical team that's in there. Just to help young people understand, when you're in that role, Kyle, who else is in that room with you? Help them just understand the variety of roles that are in that surgery room with you.
Okay, so there's your anesthesia at the head of the bed, and then you've got a nurse, circulating nurse in the OR. They are doing a lot of the charting and also getting you things that you might need during a procedure that you didn't have, or something that comes up differently. So and then you've got your surgeon and whatever helper he has, maybe a physician's assistant or a resident at the moment. Yeah, I guess that's it. And then the surgical technologist. So
yeah, so as young people know that they maybe want to work in that setting, it doesn't always have to be the surgeon. There's a lot of really important critical pieces to that team. Yeah.
Yeah.
What is your favorite part of your job as a surgical technician, or the worst part?
My favorite part, I've over the last few years have started working with a lot of the same teams, and it just is a lot of fun. We have a lot of fun during the case as well while we're getting the job done. So just the camaraderie, I guess, and then maybe something, Oh, you rely on your feet a lot. That's all there is to it. And so that can be very draining. That's probably the worst part of my job, I think.
Yeah, are you working 12-hour shifts then, or 8-hour shifts? How many days a week?
I work 12s, 3 days a week. There's always hours to pick up though, so I'm usually here at least 4 days a week. We do have 10-hour shifts too, and a few 8 hours, but most of them are usually 10 to 12, I want to say.
Yeah, so that works out for some families when you're only going to work 3 days a week, and then you have maybe don't have a different type of childcare situation because you're not having to have someone coming in 5 days a week. So
Right.
just for young people who are thinking about their family life balance, I just wanted to point that out there. When you think about your skill sets and talents and what makes you a good surgical tech, Kyla, what kind of attributes, skills, or even personality traits are important, do you think?
Organizational skills are very important, I think, in my job. You gotta know where everything's at each moment. So being flexible, just being open. You're gonna come along a lot of different personalities, I feel like, in the OR, especially with surgeons. Some maybe not so great. I don't know. I've never had any huge encounters. I've heard stories. But I think just being open, like being able to stand up for yourself too. Like, so.
Do you end up having to stand up for yourself? Give us an example of what that might look like as a surgical tech.
I think some surgeons can be a little overwhelming, and especially if they don't recognize you, or having you in their room. So just making them aware that you've got this, you know what you're doing. I'm here to help you, and let's help each other. So
yeah, and it sounds like overall you have just a really great part of your favorite was the camaraderie. So it sounds like overall it's just a really good fit for you.
Yeah, I enjoy it.
Yeah. So when you think about your patients and your job, are there stories that stand out that you might want to let the young people know about in your experiences? Something that you felt, wow, I really made a difference today, or when you went to bed at night, you're like, this job rocks. Like, give us some of those personal stories of why you like what you do.
Well, I do a lot of orthopedic surgery, so total joint replacements, knees and hips and stuff. And I had a friend of mine's family member in my room one time. She wanted me to be in there. So just seeing her outcome, I don't see a lot of the outcomes obviously afterwards. But just seeing that now she's a totally different person, and she's happy and can walk without all the pain she was in before. So that feels good.
Absolutely. I mean, I think that's one of those characteristics about your job, is that you want to serve people and help people, right?
Yeah.
Sometimes young people get kind of anxious, like, how am I going to know what to do? And obviously you went through training, formal schooling, but I'd like you to help them understand how much of it happens once you actually get hired. Do you have a mentor who shows you what to do? Like, tell us about the reality of when you really get hired.
Okay, so you go through your orientation process with many different coworkers, but the classroom to in the OR is totally different. And even after the fact, even after you've been doing this job for a year or two, you're always going to be learning something new. But just to know that, you've got other people that you can rely on and ask questions to. But learning the process, it's all going to happen once you start here. I mean, you're going to learn a lot of the basics in the classroom or whatever, and when you do your clinical rotations as a student. But once you're here full time, this is all you're focused on. It'll come to you. You're going to be overwhelmed and feel like you can't do that. I don't want to go back or whatever. But that's not the case. It'll come to you. It'll take a little bit, but yeah.
Yeah, I think that's important for young people to hear directly from you, is that you don't graduate and have all the knowledge, that it's a process and that there's people there to support you. And is it okay to ask questions, like you said? I guess I want you to tell the young people it's what you want, right? You want people to ask questions.
Yeah, exactly. Yep.
Exactly. It's cool. I know you had a few pictures to share of your workspace. I think while you're pulling that up, I'm going to have Denise, who's on the Zoom with us today. She's Blodgett Surgery nurse manager, and she's going to share us a little more information about the actual apprenticeship program that we were talking about a little earlier. So thanks, Denise, for helping us out with that.
Sure. I just think it's a super exciting opportunity for students. You could start in this program right after graduation from high school. It's a 2-year program. And right now it's completely free. Plus, when you're working during your clinical time, you get paid by Corewell Health. And you also receive benefits like a benefited employee, like you're a regular staff member while you're getting your free education. So you really can't beat that. We've limited it at this point to internal candidates, but hopefully someday we can open it up to people that are not working within Corewell Health. We do have other entry-level jobs available though, and that is also within surgery. So when you're done with your high school education, we do hire, they're called surgery and support techs. And that would be a way to get into the Corewell system. It would align you well to start the apprenticeship program. So that is a pretty exciting thing that we have. And when you're done, you can be like Kayla. So pretty good job. She neglected to mention some of the perks. You never have to buy clothes. You get to wear scrubs all day, which are sort of like wearing your pajamas to work every day. So yeah, there's lots of, and the schedule, Kayla mentioned 10-hour shifts, 12-hour shifts. There's night shifts. We've just introduced working every weekend, then you don't work through Monday through Friday. Sometimes that works well for people that are going on for more education or have a family, or lots of flexibility as far as work hours when you're talking healthcare. So just some of the other perks. I'm going to turn it back over to Kayla.
Thanks, Denise, for that insight. And surgical support techs, young people and counselors, if you didn't hear that job title. And I know sterile processing technicians, the people who get all these beautiful tools that we're looking at ready, are another way to get inside Corewell Health, which is the renaming of Spectrum Health, so that you can be one of those internal candidates. So there's many pathways that you never have to go to college debt. So thank you so much, Denise. All right, Kylo, that looks pretty intimidating on that screen. What do we got there?
So this is a picture of a setup for an orthopedic case. Probably a total knee. I can't see the whole picture now, sorry, but and that's just part of it. That's the only picture I had of that table, but drills and saws and all kinds of fun stuff.
I love it. And that's why some people really do benefit from starting off as a sterile processing technician, right? Because they're the ones that are cleaning those tools and they're learning the names of them, which makes it that much easier to do what you do, right?
Very important part of what we do.
Yeah.
Definitely need lots of help down there too in that department. So
yeah, you guys, it is only, you have to be 18 and a graduate. You don't have to have any other training. They'll train you on the job. So heads up for a sterile processing tech. All right. Did you say, I'm sorry, you had other photos you said?
I have 2 more. Yep.
Yep, that's great.
That's me.
I love
Did
it.
it come up?
Yep, sure did. So tell us about why that's important to have that big plastic garter on your face in case young people are
that's basically for our own protection. So just to keep any of the bioburden and anything flying through the air off of us. So yeah.
Yeah, because when you're sawing,
those are our space suits.
I was gonna say, when you're sawing, it's not all nice and tidy. Things are flying around.
Right. Right. Yep. And I just have one more. This is one of our one of the surgeons in our department. He's the one there on the left. And there was a day I was in his room where I had him do my job and I got to do a little bit of his job. Not necessarily. There was a resident there too, and it was his last case of his schooling there. So that was kind of a fun day. He stepped in and it kind of blew him away. He's like, I didn't really realize all that you had to do back here. And I said, yeah, we do. So then he thought it'd be a good idea if all of our residents went through a little bit of that. So I think they've been doing a little bit of that, but those are fun days. So
those are fun days, and you're helping people feel better and get better health too on top of it.
Yeah.
What would you like young people to know as far as maybe a myth of what a surgical tech is, or maybe some untruths? I think most people haven't heard about it, to be honest, but What would you want to make sure to set young people straight on why this is such a great career?
Well, I think I kind of said it a little bit earlier, but I don't know if I'd really call it a myth, but like one of our instructors said a couple of years ago, like we just are instrument passers, and to let people know that there's more to it than just that, I guess. So that I wouldn't really call it a myth, but I guess I don't know how to describe it otherwise. But you know, like I said, you get working with a lot of the same surgeons or in the same specialty, and you start to learn a little bit more about how you know, I'm sorry, the process, and you might know what that surgeon needs before he even knows he needs it. So yeah, our job's really important in that.
So let's say we have a young person on the Zoom today who's like, I really like to check this out. Obviously, they're going to do some career research, and please stay on, young people. I have some websites to share with you. Do you guys do job shadows at Corewell Health? What would they do as far as the next level before they commit to a program? Any career exploration going on there?
I know that I did. I was already employee of well, it was Spectrum back then. I was already an employee here, so not within the OR though. But yes, I did get to shadow, and I'm assuming that's a possibility. I don't know. Maybe Denise knows more.
It's difficult because of the nature of surgery. We try to keep limit the amount of people that are coming in. So that's a little bit of a sensitive subject. I would encourage everyone to really do a lot of research before that step. And then if that's something, you can YouTube a lot of things, you can see it in a lot of other ways, because we do, for the privacy of our patients and the sterility, try to keep it to a minimum, but that is, it is a possibility if you're really thinking you're leaning that way.
Yeah, I think you give good advice, Denise and Kyla. There's so many YouTube videos. There's no reason you can't be really educated about what this is all about, even with our career chat today, so you know you're making a good choice. I do know that obviously some departments are much easier to bring kids in, and it was since COVID, you know, we just know it's just that much. There's just more realities of, like you say, sterility and making sure everything is safe and everything. We have a few minutes left. I'm wondering, Kyla, when you look at your career and you've been that dental hygienist, you worked in radiology, you were considering nursing, what do you think you picked up along the way? Would you do anything different? Do you think that was the right path for you to kind of be trying these different things to land where you are now?
Yeah, I mean, I guess everything happens for a reason, right? Yeah, it's definitely eye-opening though to see many different things like that. Even as a nurse tech in the ER, it really was eye-opening to a lot of things that you just don't know when you're not in that, you know, right in there. So yeah, I mean, I learned a lot along the way.
And if you're a high school student, I do want to put a plug for our Kent Career Technical Center. We do have a nurse tech, patient care tech program. And so as a junior or senior, you can be part of that. And that gives you a lot of some basic knowledge to really understand what these careers are about, so you can make a good educated choice. Denise, when you're looking at your staffing, what other jobs do you want young people to know about that maybe they didn't know about? Like Kyla didn't know about this when she was high school. What would you want young people to know, that there's some openings in XYZ areas too that we really need people? Check it out.
Well, I think it's interesting. Kyla started out in the ED as a nurse tech. I think anything that you can get your foot in the door, and whether it be a transporter or any of those jobs, at least exposes you to different areas. And then you can ask around and maybe shadow in a different area. So I think any entry level position that Corewell offers, whether that be a nurse tech, a surgery and anesthesia support tech like we use, transport, any of those roles are just really, I think Kyla mentioned SPD, a sterile processing department. Any of those are great entry level and get you exposed to different areas to know if you like the healthcare setting.
Yeah, my daughter worked at Corewell for 2 years while she was in part of college, and she worked in nutrition, you guys, and nutrition started at 16.
I was going to say that too.
So. Yeah.
I actually started out in environmental services, so that's a little eye-opening too. Like I understand what when they're in our department to help us, I understand what they're going through, and I step in and help them sometimes. So even if you know that healthcare is the route you want to go, any way you can get into the system to then help move up the chain is any way works. So
right, exactly. And many as young people know, there's many positions you have to be 18, but not nutrition. And so my daughter started learning so much about different diets because she was taking the orders after a year. She started learning about heart healthy diets and low potassium diets. And you just end up learning some of that lingo of the hospital. So when you do go through training, you just have that advantage because you've even just heard the culture and the way that things go on. So I just put in the chat if anyone has any questions for Kayla or Denise. We have about 3 minutes left. I always have lots of questions, so I want to give you guys a chance to comment. But first of all, I noticed that you have a pretty cool looking head covering. So you get to show a little bit of your personality, it looks like, in the operating room.
Yeah, there's some people that have a lot of those. Lots of different hats.
Someone has a custom made little business on the side where they make those for people in surgery. Is that how it works?
Yeah. I will say I reached out to the program director at Baker to ask her a few questions. And I just want to point out too that we are a high demand career right now. The growth is big, 6 to 10%, she says, in the field. Median wage right now is right around 49,000. And I feel like there's some increases coming our way, hopefully. So.
Yeah, and young people, that's for a 2-year degree. Remember, you're making almost $50,000 on a 2-year degree. And I don't know if it's happening now, but I know just even a few years ago, there was a $1,500 sign-on bonus. So I don't know if there's sign-on bonuses going on right now or not, but
I think they're bigger than that these days.
Okay, so again, another incentive.
We have a 10 grand right now for surgical technologists, and then they just received a 10 grand retention bonus as well. So it's a high demand field, and we're really trying to recruit and retain people like Kayla.
Well, this has been great to hear about it today, having you, Kayla and Denise. Kayla, this is your last chance for just a little word of wisdom for these young people who are exploring what they want to be when they grow up. What would you like to share?
Whether it's healthcare or something else, just, take your time and ask lots of questions, and you got lots of time to figure it out. I mean, no one should really know exactly what they want to do at this age. It's a long time.
Yeah,
it's a long time.
And just like your story is showing, you don't have to, whatever you choose now, it doesn't mean you're there for the rest of your life. You can make changes. And I love that, Kayla, about your story. So thank you for being here today. And I'm going to stop recording. And then if anyone else has any final questions, but I have some resources I want to share with young people. Thank you, Denise, as well.
Thank you.